Hello, I'm Neil Coker. I'm Temple College's Director of Clinical Simulation. This is an orientation to the Laerdal SimMan Essential simulator and to the trauma rooms in the emergency department of Temple College's Clinical Simulation Center. To begin with, we'll talk about how to work safely with SimMan Essential. First, when you work with any of our simulators, please wear gloves. That is primarily to protect our mannequins. If you touch the mannequin with your bare hand over time, skin oil will transfer onto the mannequin's surface and stain the plastic a yellowish brown color. That's why old Resusci Annie mannequins always have that yellowish brown stain in the center of their chest. That's skin oil from people's hands. So please wear gloves. If you are carrying an ink pen with you, please ideally leave it outside the simulation room. If you feel like you need to carry it, leave it in your pocket at all times. Keep it capped. If you start moving an ink pen around close to the simulator, there's a possibility you may make an ink mark on the plastic. It is almost impossible to get ink from ink pens off of these mannequins, so please no pens anywhere near the mannequin. If you have begun to pick up the habit of writing notes on your gloves when you work, for charting information about the patient later, please don't do that here. If you write your notes on your glove and then forget and touch the mannequin, you can tattoo the vital signs you just charted on your glove onto the mannequin's skin. Also, please do not lay photocopied material of any kind down against the mannequin. Photocopy ink also can transfer onto the mannequins and stain them. It's okay to clean the mannequins with alcohol. Please do not ever put betadine on them. Betadine will stain them orange permanently. If you open any type of kit or tray that contains betadine, please immediately throw it into the trash. Don't bring it anywhere near the mannequins. Again, it is okay to use alcohol on the mannequins. Now, a few quick comments about the SimMan Essential simulator and his features. Working from the top down, he has a speaker in his head. That speaker is connected to a microphone in the control room down the hallway. As the instructor watches you using the ceiling cameras and listens using the microphones that are located both on the ceiling of the room and on the simulator, he or she will be talking through the microphone or through the speaker in the mannequin to simulate the patient's voice. Try to think of the patient as being real, interact with the patient as if they were an actual patient. After a few minutes, it will become real to you. You'll notice that the patient does blink. Blink for us, please. There we go. And the blink speed can be varied by the instructor. Also, the instructor can give the patient a kind of a sleepy, half-open look to their eyes. They can make one eye blink and the other one not blink to simulate a motor deficit, like the one that, for example, might be caused by a cerebrovascular accident. The SimMan Essential has pupils that can be varied in size by changing out a pupil and iris insert that clips into the mannequin. That is a one-time change that can be made at the beginning of the scenario. The instructor cannot vary the pupil size from the control room once the scenario has begun. So you can check pupils initially during your exam of the patient, but don't expect them to change in size as the scenario progresses. The simulator has an extremely realistic airway that will accommodate invasive airway devices. It's possible to intubate the patient. It's also possible to place a combi tube or a laryngeal mask airway into the patient. When you intubate these patients, please use the same precautions you would use with actual patients. Do not pry back on the central incisors with a laryngoscope. This mannequin currently has soft teeth in that will bend if they're pried on. However, it's possible to pop these out of the jaw. We also have hard tooth inserts that can go into the mannequin that will actually break like a real patient's teeth. So please do not pry back on them. The patient has difficult airway features to make airway access more challenging. The mannequin can display trismus, so the jaw will clench, the tongue will swell, the pharynx can swell. We can decrease the range of motion of the mannequin's neck to simulate cervical arthritis. We can cause the patient to have a laryngospasm where the vocal cords will snap closed together. These mannequins also can simulate a pneumothorax. We can simulate collapse of the lung on either side of the chest. When the pneumothorax feature is activated and the patient is breathing spontaneously, you will see a symmetrical chest rise, so the side that's affected by the pneumothorax will not move. If you ventilate the patient with a bag valve mask when a pneumothorax is present, the side that the pneumothorax is on will not move. Also, when you have a pneumothorax, you will lose the breath sounds on the affected side of the patient's chest. If you think the patient is developing a tension pneumothorax, you can perform a needle decompression of the chest. There are soft spots on the patient's chest wall to simulate the second and third intercostal spaces. You can place a needle through one of those soft areas, and when you enter the simulated pleural space, air will whistle out of the needle at you. Now, even though with a real patient you would probably use a 14 gauge 2-inch needle to perform a pleural decompression, when we stick the simulators in the simulation center, we always use 20 gauge needles or smaller. Okay, we never use large bore needles on our mannequins because they tear up the plastic more quickly. They make big holes. 20 gauge or smaller needles will make little holes that will close up very quickly and allow the mannequin to last longer. The SimMan also has the correct anatomy in his neck to perform a surgical airway. You'll notice that there's this skin collar on his neck. You can cut through the skin collar and through the underlying piece of pink tape to access the lower airway and bypass an upper airway obstruction. Once you've performed a surgical airway on the mannequin, you simply replace the piece of pink tape from the roll that you'll find in the room on the difficult airway cart, and you rotate the skin collar just slightly to move the cut out of the way, and now it's possible to obtain additional surgical airways on the same collar. The SimMan also will take a nasogastric tube. A nasogastric tube can be inserted through either of the patient's nostrils. Anytime you insert any type of tube into one of these mannequins, please use the Laerdal mannequin lubricant that you'll find in the room. This is simply glycerin and water that will make the tubes slide a little bit more easily into the mannequin. SimMan has lung sounds, heart sounds, and bowel sounds. There are 4 speakers for the heart sounds that are located in the standard locations for cardiac auscultation. So there is a aortic, pulmonic, tricuspid, and mitral speaker on the chest. The mannequin also has speakers for each pulmonary lobe anteriorly and posteriorly, and there is a speaker in each abdominal quadrant for bowel sounds. To attach the patient to an ECG monitor, you don't need electrodes. This is true of all of the Laerdal monitors or mannequins. On the patient's chest, you'll notice we have metal posts. The ECG leads simply snap down onto those posts. And once they're in place, and we've selected an appropriate lead from the cardiac monitor, we see electrocardiogram. So again, just snap the leads directly onto the posts on the patient's chest. You do not need electrodes. The same is true of the defibrillator pacing cable. There are large posts on the patient's chest, here and here. To attach the pacing defib cable, simply snap the leads directly onto those large posts. You don't have to apply electrodes to the patient's chest. The patient can now be defibrillated, cardioverted, or paced. You can use electricity from an actual patient monitor. We do caution everyone to remember that even though it is a simulated patient, it is real electricity. And even though the patient is mostly plastic, he does have some metal components, so there's always the possibility that he might have become grounded. When you shock this patient, clear the way you would clear if you were shocking a real patient. The site here in the middle of his chest is for placement of a sternal intraosseous line. That probably will not be used that frequently. If we move downward toward the patient's legs, you'll notice that he does have genitalia. There are inserts that can be placed in the mannequin to make them either male or female. These inserts can be changed out. It is possible to place a Foley catheter into the patient, and if the instructor wants to, we can set the mannequins up so they will return urine through the Foley catheter. You'll need to talk with your instructor about whether or not the mannequin is going to be returning urine during your simulation, or whether that's something that you'll just be told. You'll notice that on the patient's left leg, we have another site where an intraosseous line can be placed. Moving back up to the top of the patient, we'll talk a little bit about pulses. The patient has bilateral carotid pulses. There are bilateral radial pulses on these mannequins. One thing to know about them, though, is they are a little bit higher than a typical radial pulse. I'm feeling the pulse right now, so it's a bit higher than you might actually normally palpate for a radial pulse. There are bilateral femoral pulses. The SimMan Essential also has pads located behind the knee where you can feel popliteal pulses, and in the feet there are locations for dorsal pedal and posterior tibial pulses. So you can feel carotid, radial, femoral, popliteal, and dorsal pedal and posterior tibial pulses bilaterally. There also is a brachial pulse. That's in the patient's left arm only. The reason the brachial pulse is located in the left arm only is because in the right arm we have this IV pad. Okay. On the SimMan Essential, this is the only location where you can start an IV. You can place a tourniquet on the mannequin's arm to help the veins become more obvious. You notice as I squeeze down the upper arm, the veins are distending slightly. As with all other sticks we perform on the mannequin, we will use 20 gauge or smaller IV catheters to stick this pad. No large needles. Okay, so 20, 22, 24 small needles so we don't damage the plastic. Once your IV is in place, you can run fluid into the mannequin, you can push drugs. However, if you forget to take your tourniquet off first, your IV won't run. So you have to remember to remove the tourniquet from the mannequin. Fluids, medications that are put into the mannequin drain through a tube into a reservoir under the bed.